Summary. Priority Health is a health insurance company in the state of Michigan. They are the second largest insurer within the state. Blue Cross Blue Shield of Michigan, they are the first. But Priority Health is different than Blue Cross and Blue Shield. They're different because they are a nonprofit and part of a health system, and that makes them unique. Health system planned owned insurance companies are one of a kind. The most popular, I would say, is probably Kaiser in the state of California. But for the most part, health insurance companies are not health plan owned. So your Blue Cross Blue Shields of Michigan, your United Healthcares, Aetna's, Optum's, they are not associated with a health plan or with providers. So Priority Health is unique in that space. Priority Health is an insurance company that offers many type of insurance plans. They have a stakehold in the commercial space, offering HMO, POS, PPO plans to fully funded groups and to self-funded groups. So the difference between that, a fully funded group, Priority Health is taking on the financial risk, whereas self-funded group, the group in which purchases the plan, they take on the financial risk and pay the claims, and Priority Health is just an administrator. They also have space within the Medicaid and Medicare market. These are government owned products. Medicaid is a state funded product, where Medicare is a federally funded product. Like I said previously, Priority Health is a health system owned insurance company. But what makes them unique and stand out to me is that while these two entities provide different services, they still have a shared mission, vision, and value set. Their mission is to improve health, instill humanity, inspire hope. Their vision is a future where health is simple, affordable, equitable, and exceptional. And their values are compassion, collaboration, clarity, curiosity, and courage. And so these three elements are so simple in the way that they apply to both the caregiver and the care payer. Corewell Health recently merged, and I'll talk about that in just a moment, but they came up with this statement. At our core, we are here to help people be well so that they can live their healthiest life possible. And I just think that's such a beautiful statement because it speaks to all aspects of a person's wellness. So when doing the analysis for this, I looked at just Priority Health as they were within the state of Michigan. I didn't look at them as a national payer. So their strength is they're the second largest health insurer in the state of Michigan. They insure 1.2 million lives within the state. They're the largest system-owned insurer within the state. Like I said, I think the next closest is HAP, and I want to say they only have like 300,000 lives. So there's a big difference in between Priority Health's presence versus HAP's presence. One of their weaknesses is the parent health system, which I said is Corewell Health. They recently merged with Beaumont, so Spectrum and Beaumont became Corewell Health. These two systems have two different values sets. However, they recently defined the new mission, vision, and values for their new brand, which I recently read for you. This is a weakness because you have two systems coming together, and while the brand is and the mission, vision, and values are well articulated, these two entities are still, they have their own presence, and so they need to embrace the new. Another weakness is loss in Medicaid membership. So one of the things, I'm not sure if people are aware of this, but for Medicaid, if a person qualified for Medicaid within COVID, they kept their Medicaid benefit and they did not have to verify that they still were eligible to qualify for Medicaid. So like if their income increased, they were still eligible to keep their Medicaid. Well, now that the COVID pandemic is coming to an end, the government has decided to get rid of that requirement. And so now people need to verify that they're still eligible for Medicaid. So the health system, or Priority Health, is anticipating losing membership come April. An opportunity is the branding of Corewell. So these two entities, Spectrum and Beaumont, came together to make Corewell, and they have this beautiful brand. Like I said, their statement where they want wellness to be the focus. I think it's just a great opportunity to get the entire state on board with their mission, vision, and values. They also have an opportunity within the Medicaid state contract. So, like I said, Medicaid is run by the state of Michigan, but they allow people to bid for specific counties. And right now, Priority Health only has a small portion of the counties. But with this new merger, they have a present provider presence in all counties within the state of Michigan. And so they have the opportunity to gain those counties within the state. As always, within healthcare, the threat of the rising costs, it's always plaguing healthcare, as well as overpriced drug spend, as well as inflation. And healthcare also faces staff retention concerns. I'm not going to spend too much time on this, but this strategic factors is how I gauge what the priorities should be within the strategic plan. So it helped focus the attention on two specific areas, and those two specific areas were growth and cost savings. So my recommended strategy is to focus on growth within the Medicaid market, within the Medicare market, and also those individual plans that were instituted under President Obama. There's also opportunity for cost savings. Preferred contracting with providers now that the Beaumont providers and East Side physicians are familiar with Priority Health, we have a better relationship with them, and so there's more contracting opportunities. There's also opportunities for cost-effective site of care, as well as directing the right pharmaceuticals. So let's talk about growth. To grow membership within Priority Health, there are a few strategies that are recommended. With the implementation of verification of Medicaid members, Priority Health has individual plans. They already have the relationships established with those PPACA plans on the exchange. And if you're not familiar with those plans, so if a person falls within a certain income bracket, they're eligible to receive assistance in getting their premiums paid. So while a person might not qualify for Medicaid, they might qualify for monetary assistance within the individual plans. So I would propose setting up a marketing plan for those who are falling off the Medicaid eligibility and get them connected with someone to help them enroll within the individual market plans. It's a simple process. It's just a click away, but sometimes just having a phone presence or a calling presence or an email presence just to get that information in the person's hands to know, hey, I'm sorry, you no longer qualify for this plan, but we have this option for you. They're already familiar with the Priority Health brand and services, so it's an easy transition. Another opportunity for growth is in the Medicaid market. And like I said earlier, Priority Health only has presence in certain counties within the state of Michigan. However, the state of Michigan is offering or opening up the bid in 2024. The Medicaid product within the state of Michigan, Priority Health already has the network of physicians established within the entire state. They also have many opportunities where they are doing outreach to help the underprivileged get the medical care that they need and the assistance they need. They have programs for new mothers, they have programs for diabetics, they have programs for people to help get their medications. So they are Priority Health is a very community-faced healthcare provider, and they have a great chance in getting the state-wide contract. There's also room for the Medicare space to grow. Priority Health recently received a 5-star rating for their Medicare products, and what this means is, well, Medicare once a year gives out ratings to all their health plans, 1 through 5-star rating. Very few health plans get a 5-star rating. And those plans that get a 5-star rating, they are able to market their Medicare products the entire year. All other plans who have a 4.5 and below, they only get to market their plans for like, I want to say it's like 3 months a year. So the fact that Priority Health has a 5-star rating and can market their Medicare products the entire year, this gives them a growth advantage in all areas in the state of Michigan. It also, when the CMS or the government sends out anything, the plans that have the higher ratings, they get their information pushed up first. So that means when someone goes to a government website, Priority Health will show up first in the state of Michigan. So those sort of elements help grow membership within that market. For cost savings, you have provider contracting. Now that Priority Health has a relationship with Beaumont in which they didn't have before, they're able to leverage better cost savings within their contract, so they can negotiate lower fees, which will help save costs on premiums over time. Another initiative is site of service. What this means is directing members to sites of service in which is more cost effective. So say a member is receiving an infused drug. It is less expensive to have that drug infused within an office versus going to a facility. So that's contracting with infusion centers. So it's getting a better price, a higher quality service for a lower cost, and better benefit to our members. Another cost-saving option is drug efficacy. And this is kind of a tough one because how do you put it, cost on or price on drugs, right? Well, case in point, there's a new drug for hemophilia on the market, and it only has, per all the studies done, a 50% rate of reducing occurrences, but it costs $3 million. Yet there's another drug on the market that costs still pricey, $500,000, but this has a higher proven rate. So it's steering our members to drugs that have a higher efficiency rate, Not to say that it won't be approved, if needed, but get the drugs in front of people that have the higher value. To my presentation, I feel like Priority Health is